Let me now go to the president of the Servicio Nacional de Calidad y Salud Animal, Senacsa, Dr. José Carlos Martin Campercioli, was named by decree of the president in the position in May 2018. He is a doctor in veterinary science, graduated with distinguished honors on the veterinary faculty of the University of Asunción. He has a master in administration and has also taken trainings and certifications at the Ross Business School in Michigan, the U.S. President Campercioli, it's a privilege to have you, and the floor is yours. Thank you.
Thank you very much, Dr. Carissa Etienne, Head of Delegations, ladies and gentlemen. Good morning, everyone. I would like to first of all to extend my sincere gratitude to organizers for inviting me in my capacity of President of the National Service of Quality and Animal Health in Paraguay. Today, with the permission of Minister Julio Mazzoleni, I'm here to share you about some successful intersectoral work joint effort made by the agricultural and the health sector. Senacsa is an institution that today celebrates 53 years. What a coincidence. Created with a very clear mission to support the national livestock policy guaranteeing animal health and the quality and the safety of their products. It has 1,600 staff members who provide services in more than 120 offices across the country. The results obtained reflect the impact of this work. In beef export, for example, our most relevant product went from $40 million in 2004 to $1.3 billion at the end of last year, accounting for about 10% of our GDP, and positioning livestock activity as one of the main generators of the direct and indirect labor in the country. As a veterinary institution, we know that the control of all zoonotic pathogens in their animal origin is the most effective and economical solution to protect human beings. Therefore, we have an essential role in the development and implementation of health risk analysis policies. In the area of One Health, and particularly in relation with working in zoonosis, Paraguay surveillance actions are carried out in several diseases, such as brucellosis, rabies, bovine spongiform encephalopathies, and yellow fever. In the recent years, we have actively collaborated with public health institutions, especially in the diagnosis of zoonotic diseases. For example, with the Central Laboratory of the Ministry of Health, making the brucellosis diagnosis from a significant number of samples from human patients affected by the disease. Senacsa executes active and passive surveillance and diagnosis in animals as an early detection strategy of the presence of bovine spongiform encephalopathies in animals, helping to prevent the transmission to humans. In this way, a joint work is established with the national anti-rabies centers and the regional information system for a better epidemiological surveillance of rabies and its diagnosis. With regard to the yellow fever, we are a part of an interinstitutional table conformed of many public institutions. Senacsa is in charge of sample handling, post-mortem examinations, and laboratory diagnosis in animals. Another good example from the work in the human-animal interface, we can also highlight two things that Minister Mazzoleni was telling us before: antimicrobial resistance and the training for health emergencies. In 2019, last year, Senacsa organized a high pathogenic avian influenza simulation with the international support of PANAFTOSA, PAHO, and the United States Department of Agriculture. in order to evaluate the response of the service to an eventual outbreak of avian influenza. Representatives from the Ministry of Health, the Ministry of Agriculture, the Ministry of National Defense, and more than 130 veterinarians from the poultry industry and official services from Argentina, Bolivia, Brazil, Chile, Paraguay, and Uruguay participated. Continuing with One Health, Senacsa is a member of a National Technical Committee of Antimicrobial Resistance. This committee is conformed by representatives of the human health and the livestock sector. Last year was implemented the National Plan of Antimicrobial Resistance, which aims to reduce the incidence of bacteria and prevent the development of new ones, with a wise and responsible use of antibiotics. During the current COVID-19 pandemic, Paraguay has been able to combine efforts in the multisectoral fields, particularly in the diagnosis of the disease. Since the beginning of the pandemic, Senacsa made available the facilities, equipment, and diagnostic experts on its biosecurity laboratory level 4 by OIE standards to support the performance in PCR diagnostic in Paraguay. Up to this date, Senacsa has processed 48,000 samples, corresponding to 25% of the total samples processed in the country. In the next step, we aim to move forward in the intersectoral work, looking for an improvement, obviously, in the information exchange, a joint risk analysis among the health, the agricultural, and the new guest, the environmental sector. Thank you very much.